Infertility as a journey comes with a lot of questions, and I know that you need answers. That is why I have put together this video to answer majority of the questions that you have concerning the reasons why you are not getting pregnant naturally, some of the daily habits that you have that could be reducing your chance to get pregnant, and some habits you should avoid as you're trying to conceive. Remember, this topic is not only for trying to conceive women, it is also for men as well, because you are highly involved in this journey of fertility. As a fertility coach, I find it that couples who work together in their journey of trying to conceive will usually get their positive test earlier than those who are doing it on their own. Over the years, a lot of people think that when there is a fertility challenge, it is only a woman's problem. But recent research has actually shown that about 50% is from the man and 50% from the woman. And they share it this way: 40% for the man, 40% for the woman, and 20% is a combination of both male and female fertility issues. So there is no way you can say you cannot be involved when there is a fertility challenge as a man. Well, that is not the topic of today. I am going to try to stay on topic so that I can be able to give you guys all that you need in your fertility journey within the next 10 to 20 minutes. If you're seeing me for the first time, I am a medical radiographer. I am also an OBGYN sonographer, and I am also a fertility coach. If you are enjoying what I am doing here, I want you to like this video and also subscribe to my channel so that you don't miss any information that has to do with your trying to conceive journey as well as your fertility. I am going to move right into the topic by talking about some of the things that can reduce your chance of getting pregnant naturally, ranging from mistakes women make every month in their trying to conceive journey, some habits that can reduce egg quality as well as ovulation, what men should stop doing to protect their sperm quality. At the end of the video, I am going to be sharing some fertility friendly advice that can help you in the next few months to get your positive tests. Here are some of the mistakes that women make on a monthly basis that can reduce their chance to get pregnant. Wrong timing. As the woman in the fertility journey, you know that you are the one who knows more about your cycle, your ovulation, the right time to meet with your partner, which is your fertile window. So when you are getting that timing wrong with your partner, there is a chance that pregnancy might be delayed. Number two is assumption. A lot of people think that regular period is equal to regular ovulation. It is true that you need to see your period to know that actually I am ovulating, but it is not in every cycle that ovulation happens. Number three, high stress levels. Stress on its own releases cortisol, and cortisol as it is can affect your reproductive hormones, making ovulation difficult. Poor sleep routine. You should be aiming for about 7 to 9 hours of sleep on a daily, and if you're not getting this, there is a chance that your sleep routine could be the reason why pregnancy is being delayed. Another one is excessive intake of caffeinated drinks as well as alcohol. A lot of people don't know how these things can impact their fertility health, but research has proven time and time again that these things can reduce egg quality as well as reduce your chance to get pregnant. Another one is ignoring infection in your fertility journey. Infections are one of those things that can cause issues with your uterus as well as the male reproductive system. Things like adhesions, blockage of fallopian tube, or even early miscarriages can be linked to infections. So if you're in a trying to conceive journey and you have any form of infection, you need to get them treated. Another common mistake that a lot of women make in their trying to conceive journey is relying on apps to tell them when they are fertile. Apps are very good. They are absolutely amazing idea that helps you to calculate your cycle and also helps you to, have an idea on when you are probably going to be fertile, but you shouldn't be relying on apps alone. And this is why. While apps serves as a guide, they don't give you exactly the day that you're ovulating, and sometimes your body can decide to act differently. We are not being controlled by remotes. Your cycle can decide to change at any time, and your ovulation can decide to happen at a different time than when you were expecting it to. So while you are using your apps as a way to guide you in your trying to conceive journey, you should also learn that it is not a one size fits all. There are people that apps are not going to be suitable for, especially those who have irregular cycle or those who are suffering from a health condition that makes their cycle irregular. Another mistake that a lot of people are making is monitoring ovulation rather than fertile window. Yes, your ovulation is very necessary, and your ovulation day is one of your most fertile days in your fertile window. But you have 6 whole days as when you are fertile in a cycle and you're not making maximum use of it as somebody who is trying for a baby. Another very common mistake that majority of you make is stopping intercourse on time. Recently, there has been this campaign to stop having sex with your partner immediately after ovulation because it stops implantation and things like that. While in the real sense, a lot of people don't even know when they ovulate. This will result to so many trying to conceive couples stopping intercourse even before they enter their fertile window. That particular myth has been debunked by present research, saying that if you meet your partner after your ovulation, it is not in any way going to affect your ability to get pregnant. So instead of you assuming that you have ovulated and you should stop meeting your partner, continue meeting your partner until you are sure that you have covered the whole of your fertile window. Another common mistake that a lot of people make is ignoring their cervical mucus. So you are busy looking at when app tells you that you're fertile without you looking at your body's natural mechanism of telling you when you're fertile, which is your cervical mucus. So as you're trying to conceive, look more into your natural body mechanism of telling you when you're fertile than just relying on calculations. A lot of people also ignore their 2 weeks wait. Remember, I made a video teaching you the different aspects of your cycle, which your 2 weeks wait is your luteal phase. This luteal phase is when implantation takes place in your cycle, and it is very important in your cycle as well. Next, we are going to be looking at the things you should avoid as a trying to conceive couple. So these aspects is for both the men and the women together, because both of you should be working together towards achieving your common goal, which is pregnancy. Number one is sedentary lifestyle. Sedentary lifestyle simply means that you don't have any activities that you're doing rather than sitting at a place, sleeping, waking up, going to one place, coming back, and maybe eating. Those things affect your fertility because they are going to affect how your hormones work. Maybe if you don't know, I'll tell you, your body needs movement. Number two, poor diet. Some people think that eating good food will require you to spend a lot of money, but so many people who have moved from eating poor diet to quality diet can tell you for a fact that eating quality diet is cheaper than when you eat poor diet. So if you're someone who is wondering what you should do, like what changes to make, speak to your doctor. You can speak to a dietitian to tell you how you can go about eating quality diet as a trying to conceive. This helps a lot with your sperm quality as well as with your egg quality. Next thing is self-medication. Please, as a trying to conceive, self-medication is a no-no. I know that the internet is filled with a lot of information, so you can literally go on the internet, type in your symptom, and then they will bring out a list of medication that probably can help, especially people who have gone through that kind of symptom as yourself. Don't be influenced into taking medications that you don't need, and also don't be influenced to take medications that are not approved by your doctor. Everybody's journey is different. One symptom might mean 1,001 things. So because somebody has the exact same symptom as yourself doesn't mean that both of you are sharing the same health condition. So it is important for you not to self-medicate as a trying to conceive, and speak to your doctor first before you take any random medication that you see online. Avoid the intake of alcohol as well as smoking. A lot of people don't think that this one actually matters because, you look around you and you see people who are chain smokers or people who are alcoholic and they have children. The truth is, it will not affect everybody, but there is a percentage of people it will affect, and it could be you. So if you're somebody who is always on alcohol and you are smoking and you are wondering if that is the reason why you're not having babies, first thing you should do is to discontinue first. It is even good for your health, not just for your fertility. So as you're trying to conceive, you want to stay away from those things. I am coming to the end of the video, and I am going to be giving you people some tips on what you can do as you're trying to conceive to increase your chance of getting pregnant this cycle. If you love what I am doing here, I want you to click that like button and also subscribe to my channel. Put your notification on so that when next I come here, you'll be the first person to know. Number one, Track your ovulation. Instead of just calculating ovulation, track it. Tracking can be by monitoring your physical changes, or tracking using ovulation test strip, or even going for follicular tracking ultrasound. I have some videos teaching how to track ovulation, and you can actually watch them and learn a lot from it as well. Number 2, prioritize your sleep. 7 to 9 hours. It is not negotiable. It is very important for you as someone who is trying to conceive for the proper function of your hormones. 3, don't live a sedentary lifestyle. Gentle exercise is good for you. Not exercising at all is not okay. As somebody who is trying to conceive, I usually tell my clients that everybody has a type of exercise that they can do. Even people on wheelchair have their own exercise. What makes you think that you shouldn't exercise because you're trying to conceive? Please, it is necessary. So, low-level aerobic exercise, very good for your routine. You can be doing it for 3 to 5 times a week, and this helps you to stay healthy. Another thing you should do is to time intercourse smartly. You know, when you only meet your partner on ovulation day and every other day you don't do anything, this time focus on meeting with your partner during your fertile window. This is 5 days before your ovulation happens, day of ovulation, and the day after ovulation. You shouldn't also neglect your luteal phase. Your luteal phase is your 2 weeks wait. So after your ovulation, you see that time after your ovulation, don't neglect it. Some of the things you can do during your 2 weeks wait: you can rest more. You can try stress management and make sure that you are eating quality diet at that time as well. This nourishes your body and gets your endometrial cavity, which is the lining of your womb, ready for implantation. Another thing you can do is to use fertility-friendly lubricants. So as you're trying to conceive, if you're noticing a lot of dryness or you don't understand whether your cervical mucus is coming as it should, even after confirming ovulation, lubricants can be of help. I'd usually advise my ladies to be a lot more hydrated, and it helps a lot. But if you're doing that and you're still noticing that your arousal fluid is not sufficient enough, you can use lubricants, but make sure that you're using fertility-friendly lubricants. The recommendation is usually water-based lubricants, and when you get any, make sure that you read the label properly and make sure that it doesn't contain spermicides, which are things that are put in to kill the sperm or stop them from moving. Last but not the least, please seek clarity from your doctor or your healthcare provider early. I am always here to help. So if you have any question, you can put in the comment section and I might do a video for you. I hope you've learned something today. I am still your Wongo Nation president, and I will see you all in my next video. Bye.